I see in rabbits. I've got to say actually osteoarthritis is one of the most common conditions, although it is very, very underdiagnosed in my opinion. And it can lead to behavioural changes such as rabbits that used to use their litter tray suddenly no longer using their litter tray, and that's often down to pain in their joints that is preventing them from hopping up into that litter tray again. But it can also lead to conditions such as urine scalding, claggy bums because they can't eat their cecotrophs anymore. And these are signs that owners can look out for. If there has been a behavioural change in their rabbit, if it has stopped using the litter tray, or they notice that the cecotrophs are going uneaten and they've not changed the diet in any way, then I would be urging these owners to seek veterinary attention and tell your vet that you're worried that your animal could have osteoarthritis. It can also lead to, as I say, other grooming issues as well. Second most common condition I see, unfortunately, is definitely a man-made one, and that's obesity. I think as a nation, our understanding of what animal shapes should look like has changed, to the extent I often have owners very upset because they get harassed by members of the public for telling them that their dogs are underweight when their dogs are actually at the perfect body condition. And it's under 2006 animal welfare law, it's actually a criminal offence to feed your animal inappropriately. So, obesity can lead to things like grooming issues, because especially if you've got a big dewlap, and it's not just does I'm finding with big dewlaps. I'm seeing a lot of fat male rabbits that develop fat dewlaps, some of which have needed surgery to correct that flap after they've lost the weight. And again, they can get scald, they can get claggy bums, which could lead on to fly strike and maggots attacking that pet rabbit. So I think for owners, it can be difficult sometimes when you live with an animal every day and you adore these animals so much, to notice a slow increase in body weight. So I would make a conscious effort once a week just to run your fingers over your rabbit's ribs, and you should be able to feel the ribs with slight pressure, and if you can't, then that can be a sign that your rabbit is overweight. If you can feel them as soon as you put your hand on your rabbit, then that means your rabbit's a little bit underweight, and I would increase the amount of hay that you're giving your rabbit. I would say ear-based swellings is also a very, very common condition that I see. And it's much more common in lop-eared rabbits. Now that's because rabbits have evolved to have prick ears. And if you look at the ear canal in lop-eared rabbits, the genetic defect that causes the cartilage to soften and the canal to flop over results in a really narrow ear canal. So the prick-eared rabbit's ear canal is more like this, and the lop-eared canal is like that. And then what happens is that the normal wax can't get out, and then you get issues such as the wax building up. It's very warm. The tissues get swollen, they get irritated, they rub against each other, and then you get what we call kissing ulcers. Like, it's infected and it's very, very painful, and it can actually progress onto inner ear disease as well. Signs that owners could look out for is head shaking, although some rabbits will do that just to tell you off, or they're a bit displeased with something that you've done. But tooth grinding, which is a non-specific sign of pain in rabbits. But also just by feeling your rabbit's ears, you can often feel right down where the ear canal attaches to the skull. If you feel both sides at the same time, you will find that they're not symmetrical. There'll be one ear will have maybe a marble-sized swelling, or smaller if it's early doors. If you find that, you're not going to see anything by looking in your rabbit's ears, you're just going to have to feel for it, then I would definitely go to the vets. Dental issues are still quite common, although thankfully the practice I'm at, not as common as they used to be. And some ectopanocytes, especially in older rabbits like Cayetiella, nicknamed walking dandruff, because that's what it looks like. It causes very, very thick patches of dandruff. And if you rub that dandruff onto a black sheet of paper and you look carefully, you will see little bits of what looks like dandruff walking, and it's actually the mite, because Cayetela is one of the few species of mite that we can see with the naked eye. And again, especially in older rabbits, that can actually be a sign of osteoarthritis, because you would generally find it in areas the rabbit's finding difficult to groom. So if you've got a thick patch of mites of Cayetela, by all means, it's easy enough to treat with the ivermectin. But if you are treating it yourself in-house, that's fine, but you need to go to your vet to find out why it developed in the first place, because chances are it's developed because the rabbit hasn't been able to groom that area. Because most rabbits carry small quantities of these mites and they never ever cause a problem.